So our second patient-centered goal is helping Ms. Lopez get back to work. So to start with, the social worker can help and focus on finding healthcare and financial resources. He or she can aid in finding an occupational therapist who Ms. Lopez feels comfortable with and can learn from. Due to her fatigue, it was found that completing daily activities have been very difficult for her, as well as took much longer than before. So in that case, the occupational therapist will work with her and her family to complete daily activities quickly and give her the energy to complete her job. The community health worker should be present to support Ms. Lopez and monitor her progress over time due to tracking purposes. It is also imperative that the community health worker can educate Ms. Lopez on how she's improving and help her in any way to help her understand anything that she may not understand. The support from Ms. Lopez's family is also very crucial to help her getting her back to work. Creating the discussion with her family on how to coordinate transportation or how to aid in daily activities can help her enjoy going back to work and give her the energy that she needs to complete these tasks. So all of these professions coming together to help Ms. Lopez work will help her feel more financially stable and less lonely, since she will be able to interact with her Spanish speaking coworkers once again. Next slide.
As part of goal 3, for Ms. Lopez to see her grandchildren, son, daughter, and coworkers, whom she considers like sisters, it is essential to identify the barrier she is implementing. Ms. Lopez's belief is that she will give them COVID-19. As part of understanding the Latino culture, an instrument was developed called the Simpatia scale. The Simpatia scale is a measurement that captures the tendency to prefer and create social interactions characterized by warmth and emotional positivity, while also avoiding conflict and or negativity. This addresses Ms. Lopez's belief and concern that she will infect her family and friends with COVID-19. Ms. Lopez may not want to burden her family with her past illnesses or inconvenience her family. Conversations with Ms. Lopez's family are an essential part of the patient-centered care goals. Using motivational interviewing with Ms. Lopez and her family members will address their beliefs about COVID-19 and the vaccines. The community health worker will help implement family gatherings, which may involve cooking and meal preparation to help build the bonding relationships again and provide meals for Ms. Lopez and the families. Ms. Lopez and her family also need to understand the significance of her taking her medication and the positive effects of her health because of this. This, with the other patient-centered care, will enable her to see her grandchildren and provide child care once again. Education and family involvement will be ongoing for Ms. Lopez to return to work and see her family. Next slide.
The last and final goal that we have is for Ms. Lopez to once again find joy in daily life. Now, while we firmly believe in respecting Ms. Lopez's opinion toward her own health, we are also hoping to guide her toward making an educated decision on a COVID-19 vaccination. Going forward, this vaccine could remove roadblocks, preventing Ms. Lopez from finding joy in her daily activities. As Ms. Lopez travels to more public places, she is at risk of contracting COVID-19 again. She is also afraid of transmitting the virus to her family, and this could be avoided in the future if she does get vaccinated. We are hoping that Ms. Lopez's social worker, who is also the case manager, can build trust with Ms. Lopez in order to navigate the misinformation that Ms. Lopez has heard regarding the vaccine. The social worker can also help Ms. Lopez access other social services that can provide financial assistance as Ms. Lopez regains her strength and prepares to go back to work. This includes programs such as EBT, or electronic benefit transfer, which provides a monthly stipend that individuals can use to spend on fresh fruits and vegetables, which will be really important for Ms. Lopez as she starts cooking again. A therapist can also help to ease Ms. Lopez's opinion toward the COVID-19 vaccine, and the therapist can provide emotional support for the depressive symptoms Ms. Lopez has been feeling toward her recent life. Ms. Lopez's medications will boost her overall livelihood, making it easier for her to carry out the activities she enjoys. A dietitian will assist in meal planning. These planned meals will aim to be both nutritious and easy to follow so that Ms. Lopez feels capable of cooking for her family, which she misses dearly. While Ms. Lopez is actively working to resume her daily activities, a community health worker can provide additional support by being present at the home to assist Ms. Lopez if she feels overwhelmed by any of the changes in her routine. In time, Ms. Lopez will be able to carry out these activities unassisted, and the community health worker will be needed less often or possibly only by phone. Lastly, Ms. Lopez's family will be essential in this goal because they will provide emotional and physical support and remind Ms. Lopez of her joy for cooking and other activities.
So since we have discussed patient-centered goals, I will briefly touch on a future goal for Ms. Lopez, which is providing dental care. So as you can see, her concerns include swollen and bleeding gums, mobility of her teeth, spaces between her teeth, as well as halitosis. So a social worker can work with Ms. Lopez and her family to find a bilingual dentist who she feels comfortable with and can help her with her discomfort and concerns. A dentist will work with Ms. Lopez on creating a proper dental plan that fits her schedule and her wishes. It's important to note that since she is diabetic, she does have a higher caries risk and can take longer to recover from periodontal issues that she may have. This is why it's very important to educate her on her oral hygiene habits to help her with her overall health. This includes teaching her how to brush her teeth correctly, how to floss, and what types of food to ingest. So her diet may improve as well through this education. As her oral cavity heals, Ms. Lopez will understand how to better manage her health and feel more confident in her smile as time passes. Next slide.
Now, this is a slide that will discuss briefly the family's role in the care team. Amelia is going to be Ms. Lopez's main support in this care team because her work schedule allows her to support Ms. Lopez and be present at home along with the care team. Mateo is also essential because he lives nearby and he also can provide social support by being there at the house. Additionally, he might be able to provide some connections to health insurance through his work. However, that would have to be assessed going forward. Ms. Lopez's daughter is also a really important lifeline, although we do have to keep in mind that she does live far away. However, she can be available by phone and will help as support as Ms. Lopez is starting her new routine with her medications. She can remind her when to take her medications and also assist and support around other general good behaviors. Lastly, we have Ms. Lopez's grandchildren. As Ms. Lopez's energy is restored, her grandchildren can provide social support and also support in doing new physical activities. Previously, she loved cooking for her grandchildren, and her grandchildren can provide support as she begins that activity and once again finds joy in daily activities.
So we have mentioned the various interprofessional roles, but this chart shows just how much they overlap. The different professionals can communicate with each other using an electronic health record system, which allows documentation from all the different professionals to be visible by everyone. However, this would typically just work if they're all part of the same system, but if this is not possible, they can also use other secure forms of communication such as paging and secure email. Her care team can also have vocational huddle for care conference calls, which are just updates to give quick updates from each of their different perspectives on Ms. Lopez's progress. Logistically, this may be hard to include everyone on these calls, but whenever they can occur, they would be beneficial. Our care plan focuses on the role of the social worker and the community healthcare worker because they are essential in addressing Ms. Lopez's barriers to healthcare access and are most feasible at this time. Because Ms. Lopez lives relatively far from the clinic, focusing on other means of healthcare is important as she cannot always go to the clinic for all of her health needs. By addressing these patient-centered goals, we hope to improve the outcomes and quality of life for Ms. Lopez. Next slide, please. Lynette, you're muted.
Okay, thank you. Our interprofessional team included pharmacy, public health with a background nutritionist, masters of dental hygiene student, and a dental student. A shot, tumors, and Nortograph address the need to identify gaps between interprofessionals for success. The first is called professional perspectives. This type of gap addresses professional views on the best way to treat the patient. Each member of our team learned about each other's professions, professional values, and norms. They were considered for each option regarding the plan of care for patient-centered care. Each member brought forth strengths that helped the success of our team. The second gap is bridging social community, understanding each team member's personality and communication preference. We addressed communication in our first meeting. Our personality differences were to our advantage in both the academic and working knowledge experience. The third gap is the communication division. Understanding each profession's verbiage was identified and clarified if any language barriers existed. And lastly, the task division gap. To address this gap, Ms. Priya captained our team to help facilitate meetings. Each member was engaged in discussions during our sessions. We used GroupMe, Zoom, and email to engage as a whole collaborative team. Overall, our experience reinforces that interprofessional teams should be implemented and utilized to provide patient-centered care to the best of each profession. Interprofessional interaction is a vital part of the academic environment, and each of us recognizes the significance of this in our future careers. We would like to thank the judges, our coach, Dr. Todd James, for his knowledge and guidance as part of our team. Thank the Health Resources and Service Administration of the U.S. Department of Health and Human Services, Geriatric's Workforce Enhancement Program, Otto Bremer Trust, and the University of Minnesota Office of Academic Clinical Affairs. Thank you.